Hi, you're watching Hindustan Times and I'm Aditi Prasad. At a time when patients across the country are literally losing their lives due to oxygen shortage at hospitals, tragic news is coming in from Nashik. At least 22 COVID patients have died after an oxygen tanker leaked at Dr. Zakir Hospital in the city, which led to disruption in oxygen supply. Now, visuals from the incident site show, as you're seeing on your screen, gaseous oxygen spreading across the area, which was supposed to be used by the hospital. Now, more than 150 patients, COVID patients, were admitted in that particular hospital. In fact, the battle for oxygen is now also pitting state against state and hospital against hospital and central government against state governments. It's really an oxygen emergency in the country. To discuss these issues and more, I'm joined by an expert panel. We have Hindustan Times Yogesh Joshi, our reporter, our bureau chief in Pune, who has been tracking the Nashik incident. We're also joined by Dr. Vijay M. Natarajan. He's the CEO of Symbiosis University Hospital and Research Center in Pune, whose hospital has over 200 occupied COVID beds with oxygen facilities. But he also faced an emergency shortage last night as their designated supply was diverted to another hospital. Now, also, I'm joined today by Dr. Dhureen Gupta, a pediatrician who practices at the Sir Gangaram Hospital in New Delhi, a prestigious private hospital here, another hospital that has been facing an acute oxygen shortage in the national capital and is barely coping. Let me start with you, Yogesh. Uh, for more on this incident, we understand that the oxygen supply was reduced for half an hour due to the leak, because of which so many lives of patients who were on ventilator were lost. What have you learned so far about what exactly went down at that hospital?
Right. So, like you said, it couldn't have come at a more worse time. Maharashtra is facing one of the most acute shortage of oxygen. Maharashtra government is trying to, all of its oxygen that is being generated, that has been produced here. They're also getting oxygen from Andhra Pradesh, from Gujarat, and also from Chhattisgarh. And when on one hand we are facing oxygen shortage, the tragedy struck in Nashik, where a municipal corporation run hospital having a bed capacity of a 150 patient faced a tragedy after a oxygen supply was interrupted. As the ventilators require a particular level of oxygen supply, constant flow, the interruption in oxygen supply after the leakage at the oxygen at the storage cylinder uh, that disrupted the supply, and the supply level dropped. It led to the death of 22 patients. 15 on them were on ventilator. The rest of them were critical, but on O2 support, oxygen support. Now, the
Hmm.
state government has, of course, ordered an inquiry. We'll know who is at fault, who is not at fault. But this is a massive tragedy coming 2 months after yet another tragedy in a Gondia hospital where 10 newborn had to die because of a fire incident. So, on one hand, Maharashtra's healthcare workers are facing a huge pressure. This is a big shock, big tragedy for them.
Right. This incident was reported around 10 a.m. When the socket of oxygen tank malfunctioned, and an inquiry has been offered, has now obviously been ordered. But what, when you spoke to the district collector, to the hospital authorities, Yogesh, what was coming? I mean, is this a case of is this, was it an accident, or it's just sheer criminal negligence? I mean, I'm sure the you know inquiry will reveal all details later. But what are they saying prima facie right now?
Right. So, based on what Maharashtra's Health Minister Rajesh Tope has said, uh, uh, the responsibility of maintaining the oxygen supply was with a private firm based in Chakan in Pune district. They had come to refill the jumbo cylinder there. when they were actually refilling that cylinder, they spotted an oxygen leakage that was exactly at the socket. Now, whether it was a negligence or a workman fault, because a few days back there was a repair work carried out there, is what the authorities were saying. And Tope also said it will only the inquiry, high level inquiry ordered by chief minister, that will establish whether it was a negligence or a workman's fault. But yes, there was some technical issue there. The leakage led to the drop in a supply, which eventually resulted into the death of 22 people.
It's a tragic incident coming in from Nashik. Dr. Natarajan, I want to bring you in here at this point. You know, when we were speaking earlier, you had pointed out that there could be the technical reasons behind this incident. Please elucidate.
Well, from the preliminary information that is available, of course, I mean, the full inquiry will reveal the entire details. But there was some kind of a stopcock mechanism which needs to be checked at regular intervals, because you got to understand that this liquid oxygen leads to freezing of the pipes. So there is a little bit of wear and tear involved, when these stopcocks or junctions in these pipes are concerned. So it calls for a daily maintenance where one has to, pour water over that area and make sure that there are no leakages there. So what probably happened, was that stopcock mechanism was malfunctioning, and that did not come to the notice of people at the time when the liquid oxygen was being actually loaded from the tank into the liquid oxygen storage facility at the hospital. And that's probably which led to this massive leak of oxygen, and consequently, the drop in oxygen supply to the entire hospital, and to each of the individual patients.
All right, so basically what you're saying, that this could the blame for this could lie at the doors of the supply company, the oxygen supplier in this case.
I'm not so sure whether it is the oxygen supplier who's responsible for the infrastructure within the hospital. I mean, this is not something in terms of maintenance where the supplier is responsible. I would think that it is the hospital maintenance department that looks at all these kind of infrastructural needs, and making sure that everything is in place and free from any kind of wear and tear. So I would think it is more related to the hospital administration and maintenance rather than the vendor themselves.
So it's basically about the maintenance to be done by the hospital staff, and I'm sure it will come out in the inquiry and everything more will come out. But in the meanwhile, let's talk about what this entire incident has laid threadbare. The one thing that is there is the battle for oxygen, which is taking place across the country's hospitals. It's pitted hospital against hospital, it's pitted state against state. We have the Haryana minister, ordering police protection for its oxygen tankers, alleging loot by Delhi. And I really want to come to you, from Dr. Gupta, to talk about the problems that we've been facing in the Gangaram hospital, because the tanker from Haryana, some of the tankers were directed to the Gangaram hospital in Delhi. So you're in mute. You'll have to just unmute yourself before starting to talk.
Okay, sir.
Or I did that for you. Please carry on.
Okay. Me, I am a doctor. What you expect from me is a good treatment. As a patient, do you think that it is a job of a doctor to get an oxygen? It's a job of administration. Administration has to be supported by a system which provides you oxygen. A system. That system is very well placed in all private hospital because they purchase, they have got all their own system. What happened? Our whole system collapsed. Whole system of government machinery collapsed. This epidemic, the second or you can say third wave, started in say mid of Mumbai and in Nagpur. Then it came to Punjab. And what the central government was sleeping. Either they were busy in the elections, or they were just opposing these farmers, and either people in the politics were either opposing the farmers and supporting the farmers. Their policy failed last year. They didn't learn, these stupid politicians, this didn't learn anything. They continue with all those stupid policies, what due to because of the past 70 years they didn't spend anything on health maintenance. You're talking about just a valve leak or something. Forget these small issues. Think of why these type of incidences do happen in our country. Why you vote for people who are involved into religions and so many fights, and rather than have you asked as a general population, I will vote unless you don't improve the health condition. You don't improve. The problem is with you people, not with us who doctor who are sufferer, who take the brunt when you get ill, when you don't get oxygen. You fight with us. Problem with you journalists who try to find out cheap stories and try to show them on television. You never take this into account that okay, healthcare, look at the government hospital. When your health minister start going to this government hospital for management, then you will say okay, now probably our health system is okay. When these people start choosing big hospitals and they leave aside government hospital where the common man die, where the common man doesn't get good treatment, that is not news for you people. The day you start projecting what is happening in the government hospitals, what happened? Whenever there is a crisis, what government does, they try to focus, they try to put on pressure over the private setup. They don't have their own setup at all. To in a government hospital, who goes, who who doesn't have any penny to eat? Otherwise, any person, even if he have got 10 rupees, he will go to a private hospital because the accountability is there. So look at the whole scenario. 3 months, they didn't learn from anything from the past. What they learn, whenever the things in crisis, look at the private hospital. Now you convert everything into a ICU. You convert each and every into ward. Stop non-COVID duties, stop non-COVID admissions, and the whole hospital, private hospital, is converted into a battlefield.
Hmm.
Instead of 500 patients, you force them to take 750 patients of ICU, like patient who require oxygen. When we talk about our hospital, we take care of quality to that extent. We normally don't have these maintenance issue at all. I'm
Right.
there for 23 years. I've heard all our hospital, nearby hospitals, good quality hospital. Everybody is feeling pressure because of the oxygen. Means this makes me remember I used to work in Safdarjung when you got a pipe cut and the oxygen delivery was not there for 5 minutes, and then ventilator stopped working, and then everybody is rushing and somebody died. I have never heard these type of issues for past 24 years. Fortunately, we have got lot of good backup. We are doing well. Everything is okay. But in 2021, we are talking about oxygen is not there in the government with the governments. What rubbish we are talking? What our governments are doing? They are still doing rallies. They have still woken up a day back or 2 days back. It's everybody's fault. It's not my fault as a doctor. I am at the receiving end.
Absolutely, sir. And you've seemed very emotional about this because you handle the children's ward. You are a pediatrician. You're
Ma'am,
handling.
the day you people are emotional, the things will improve.
Absolutely.
We are very insensitive. Once you air this program, you will also forget the oxygen theory. I am 100% sure.
No,
Nobody is going to
trust us,
take this
sir.
oxygen theory.
I
Are you going to ask? Are you going to ask Uddhav Thackeray to resign because of oxygen delivery? No, you are not able. You are not capable to do that. Your everything will be broken by the Shiv Sainiks. That is the scare of these politicians. They are not scared of anything. The day they are scared of you people, your demands, the things will improve. It is the fault of the god. It is the fault of the general people. We are taking the brunt, and everybody is taking brunt. Till now, whenever a big politician used to land up in problem, he used to skip from the India. Either he used to get some, they used to hide the disease. They used to take treatment either in UK, US,
right.
and now they have been exposed and they go to private hospitals and get the treatment. The day they start visiting government hospitals, the things will improve. One. Second, these accidents are bound to happen. These accidents used to happen in Australia also when I used to work. But
Hmm.
everything works with a backup facility. For an example, my ventilator fails. We usually use imported ventilator. That is our hospital policy. But machine is machine. If it fails, what we used to do, we used to bag that patient. There used to be an UPS system to that ventilator. Even if that UPS fails, we used to bag that patient. I never heard of patient dying because of some equipment failure in my hospital because we have got a maintenance system. Why the maintenance system and backup system was not there? These accidents are going to happen. What will happen? They will blacklist that importer or that maintenance officer, and within 10 days everybody will forget, and you will air this program, you will have good number of viewership, and you will also forget. That is happening all over past 24 years. What I am looking at, the day these buggers will start visiting private hospitals, government hospital, and they start treating, the things will improve. In Delhi, what happened? There was a road to airport that was
Hmm.
very wide. That was wide for everybody for months, and that was a bottleneck. The day the Dr. Mr. Garkadi traveled that, and he got stuck for 1 hour. The following that, within 1 year, everything improved. What happened? Our politicians take the aerial routes, so they don't know what is happening to the village.
Yeah, I
That is,
totally understand why. I totally understand, sir. And
so I
you
will,
are coming from a
in nutshell, I will say only one thing. See, who suffers? You and me.
absolutely.
Okay, not these buggers.
It's the
What
families.
we
It's those
need, what
22
we
people
need,
who died today and their
ma'am,
families.
what we
Yeah.
need a contingency plan. Accidents cannot be 100% preventable. Accidents are bound to happen whenever there is an interaction between man and machine. Try to understand. We are here to have a contingency plans. We need to have contingency plan, and nobody learned from what happened in 2020. Nobody built an hospitals. Nobody provided that if this amount of patients land up in hospital, what are the resources we will need? That is the contingency plan. That contingency plan is lacking in this country, and we don't demand for that. What we demand that, okay, is a Marathi, I will vote for a Marathi. This is a Punjabi, I will vote for a Punjabi. This belongs to my motherland, I will vote for him. Or I will vote for
You
some
understand.
idiotic
I
government. I
understand
think
there is a lot
the
of politics
day we
over
will
this.
the day we will overcome this, we are going to have a good country, livable country.
And I really would like to point out also, sir, that we've been consistently following this oxygen shortage story. You were raising some questions about what the media is doing. We are trying to raise this. We are going to continuously keep raising it from here on also. Not going to forget about it after the show. Trust us on that. I want to come to you, Dr. Vijay Natarajan, on this. You were pointing. Do you concur with Dr. Dhiren Gupta? Who do you think is to this oxygen shortage? Because you were telling me about an incident in your own hospital as late as last night, where oxygen you were landing into an emergency situation with oxygen. Can you tell us what happened last night in your hospital?
Yes. See, broadly, one has to understand the scenario as it is evolving right now. There is a certain requirement of oxygen throughout the country on a daily basis. Now, here is a sudden disaster that has happened, a crisis, and that has increased the requirement of oxygen 4 to 5 times as compared to normal. So, clearly, we don't have that surge capacity. So, there is a mismatch between the demand and the supply. Now, what happened to us last night, for example, is that our liquid oxygen tanker, which was supposed to arrive at our campus, which usually does in the evening, was diverted to another COVID care center because there was a crisis of oxygen there because their regular supplier could not provide the liquid oxygen. So it was diverted there, and which is okay. I mean, clearly at that moment in time, their emergency was greater than ours because we still had supply till 10 o'clock the next morning. So then we had to kind of run around a bit, talk to higher authorities, and therefore get that sorted out. And then we had our tanker arrive rightfully today morning at 9 o'clock. And so whatever emergency that could have happened was averted. Having said that, I mean, one has to be fair to the government as well. See, the thing is, you can always criticize and say, why did they not have this surge capacity? Valid point. We should have anticipated this whole crisis, whether it is oxygen, whether it is remdesivir, whether it is ICU beds, whether it is ventilators. Somewhere there was a degree of complacency that entered because of the dip in COVID numbers in November, December. So somewhere overall, maybe all over the country, everyone went into this kind of relaxed mode saying that COVID is gone once and for all. As much as it was a tiny virus, we failed to respect it. And sure enough, in January, February, when everything was opened up simultaneously, whether it is the movie theaters, schools, shopping malls, etc., and these kind of super spreader events like marriages and even electioneering for I don't need to tell you details
Right?
of that.
Yeah.
These are all huge super. So it is a conflicting signal that goes. On one side, we say that we should maintain social distancing, wear masks, do hand sanitization, etc., etc. And at the same time, you see these massive crowds, at either religious events or at electioneering. And sure enough, then it shows the priority in terms of last year, to put it very bluntly, when COVID first hit us, the priority was health of the country, healthcare. That was the priority. Everyone
Hmm.
was scared. This year, when you even listen to the highest authorities in the land, the priority is clearly economics, the economy. Healthcare is not the priority this year. It could be in second or third position, but definitely not number one as it was last year. So when you look at that, this all is a reflection of that whole system because of that laid back approach that COVID has gone away. So we don't really need to prepare for any kind of eventuality. It caught us completely unawares.
But
If you,
sir, I do understand what you're saying, and while I completely agree with what you're saying that the priority somehow has become, uh, and that's a very valid observation that the priority has become the economy rather than lives. the livelihoods have become more important this time around, unlike the last time. Uh, and that is actually what I think, Dr. Gupta was trying to say.
One point I want to
Yes,
make.
please.
See, let's view this technically. You know, in a given setting, you suppose you are asking me questions, but you must have people who are looking at your office, who are maintaining that office, who will be taking care of persons who are entering. Same way, when we talk about any system, we have got a ICMR, we have got a laboratory which take care of what type of virus is revolving around. We have got projected, you can say, meters where we say, okay, presently there are 10 patients, it is going to be 15th November, it will be around 1 lakh or 15 lakh. So look at this technicality. Was it taken care of? In mid of December, there was mutant strains in UK and in South Africa. Fine. Now, as a doctor, as a pediatrician, I do a lot of research also. I am obsessed with this virus. I've done lot of not only research, in the sense I study a lot of research and I keep track of this virus. I could guess when in a small virus in a small city like Wuhan entered in India and produced this chaos, the UK and South Africa are much nearer to our heart. Why can't this virus has entered? Why this virus hasn't entered in India? Probably it must have entered, and nothing. No, but nobody is testing this virus in India. That was truth. We had laid back attitude, but unfortunately, the people who are responsible. Not everybody is clinician. People who are in ICMR, who are at AIMS, who are researcher, their responsibility is to track the system. The virologist has to track the system. They didn't track for 1 month, 2 months. When you can say all your patients, despite of vaccination, started getting infection, then they came out, okay, we have got 10,000 viruses. Out of this, 1,000 were mutant. We
Right. So
needed
the
to do
mutant, yes,
5%. We needed to do 5% tracking, and they just did 0.005% of the tracking. Why? Because we are not honest in the work given to these, you can say, these agencies, what they are meant for. We are just here for to reproduce the result which people see and they get thumping and lot of things. Unfortunate part is the day we start doing our work honestly, probably prediction and contingency plan, and at times prediction can go wrong, but this has not become in a day, in a overnight. If this pandemic second third wave has come, this has come gradually. When one patient of COVID is detected, there are around 80 undetected patients. That undetected patient management and diagnosis is a work of these agencies, not a work of a doctor. We should anticipate around a month back that these mutant strains are going to strike in India. One, the number of patients, we see projection model. In next 1 month, the projection model should convey us this amount number of patients are going to be there. Actually, we didn't learn from the last year debacle, and we are again just trying to find the fault with each other. What we need to learn, we need to learn from our mistakes. And let me very honest, now this epidemic is out of hands. Let's be very frank, and this is in hands of the people. Self, you can say, lockdown is going to be the answer for next 15 days. Only then we can stop. Vaccinations are here for next epidemic, for to prevent next epidemic. We get into rumors from social media, we also forward those messages which we don't understand, but they contain false messages. So, as a doctor, as a journalist, as a human being, as any citizen of the country, if we become responsible about COVID appropriate behavior, about vaccination awareness, not getting into rumor, and try to select, try to challenge these politicians who make everybody scared under them, then we are going to change.
Fair point, sir. And I do accept your point. Right now, let's talk solutions also. And what has happened? You're saying that the pandemic, this second wave, is out of control, and now it's dependent on in us individually. The next 15 days,
Yes.
20 days, how we behave, understandably. For the hospitals, you're battling COVID. You're also battling shortages of oxygen, shortages of medicine, shortages of ICU beds. I want to come to you, Dr. Natarajan, first, and then I will come to you, Dr. Gupta, on this. What do you think? Who is to blame for the current? We've already talked about, you said that we didn't act in time, we became complacent. How do we fix these shortages? How can we resolve this shortage problem? Can it be managed? Or are we going to actually the same kind of scenes that are playing out today on across our television sets? Long queues outside hospitals, outside medical shops, people dying outside for lack of oxygen. Uh, if scenes are heartrending, sir, and I for one, and I think most of our viewers are very affected by it. How do we resolve this going forward? Because it seems that the states are fighting with each other now. The central government and the state government are fighting. Everybody seems to be fighting. Hospitals are fighting each other for oxygen. How do we resolve the situation?
Well, there are solutions provided the resolve is there from the administration. Now let's understand that again a matter of supply and demand. There's a huge demand which has increased very rapidly in the last 1 month. One must notice that as a difference from last year. If you see the rate of rise of cases, it is far, far faster this year than it was last year. Last year, the numbers rose over a period of 2 to 3 months. So it gave the health infrastructure some time to start working towards it, setting up ICU beds, jumbo facilities, getting ventilators from here and there, supplying oxygen, making certain medicines available, whether it was, HCQ and stuff at that stage, etc., etc. Getting personnel, into the system, qualified personnel, when I'm talking of doctors, nurses, technicians, all those people. This year, all that was squeezed into virtually a couple of weeks. And this is, like Dr. Gupta pointed out, a far more infective mutant variant strain, which is spreading very fast amongst people. So the number of cases is much more. And as a percentage of that, the ones who would reach an ICU or need oxygen is in absolute numbers much more than last year. So clearly it has overburdened the health infrastructure. We can't build hospitals overnight. We can't make doctors overnight. We can't make ICUs and ventilators overnight. We can't make specialized doctors like intensivists where, several years go into training, cannot be done overnight. So right now, what is the need of the hour? The need of the hour is to have oxygen beds. That is something that could probably save a lot more lives than we are currently doing. Do we have enough hospital beds? Clearly not. So what I would think is, what is the next best ready-made infrastructure which can substitute as a hospital bed? And that's where I was thinking of hotels. Hotels have beds, hotels have washrooms. All you need to do is get an oxygen facility into these hotel rooms and have doctors, maybe junior level doctors, medical students who just need to monitor the oxygen level, so that the high-end hospitals beds have to be used very preciously. You cannot use hospital beds. I'm sure nobody is, all the administration is thinking about that very judiciously, that you cannot have people who don't need oxygen getting admitted in a hospital. I mean, they
But
can
sir,
very.
this is exactly what we had done at the end of the, when we peaked in 2020, we had converted hotels into hospitals and so on and so
Just
forth.
one
But that
point. Just
entire
one point.
infrastructure was sort of dismantled once we became very complacent. Yes, Dr. Gupta, you want to come in
No,
here?
no, no. One point, sir. I will coming to that point. Very well made. I've seen this pandemic past last year and this one very closely. What happened in 2020 when this was all wave and governments were shattered as usual, expected, and they again, just pass the fatwa to the private hospitals. Okay, now you decrease the rates and build this hospital within day and change your wards and all that. Okay, now they ask the hotel to convert into a it's some sort of a semi-hospital sort of setting. Fine. So I was very passionate about helping the community. So though I started as a pediatrician, but as I told you, I researched a lot on COVID for almost months. So this way I land up in adult COVID management. And now I took the initiative that I am going to manage two hotels. Now my colleagues accompanied me. Dhiren, okay, if you are taking such a big initiative, we are with you. We asked two hotels to change yourself for patients. A hotel invested almost 20 lakhs to convert the infrastructure for the patients. Done. And there was none of the single patient came, and unfortunately, and not fortunately, that pandemic averted. What happened to that hotel? He'll end up in huge wastage, huge resource wastage. And the same thing happened in UK, United Kingdom. And my friend is running a hotel. So the government asked, okay, you convert your hotel into a hospital, we will provide you resources. So that hotel was taken up by the government. Government paid the rent to the hotel, converted that hotel into a hospital. Again, that hotel was not utilized, but whose responsibility? It was a government responsibility. What here the government does? Government point out to you, you do this. What I am doing, I will be just having interviews on the television that we have converted so many hotels into. They haven't converted, they have just ordered it. So there is a difference between the taking the responsibility. What our government does, they just order it. Now we have reached to the brink. What happens every, when we faced such a problem a year back, then what we start with, okay, I will build up my facility, a health facility, to tackle what I couldn't tackle last year. Done. I had 6 months as an government person, as a, you can say, as a manager or as a policy maker. Now during that 6 months, they should have thought of what fault, where we faulted last time, because virus didn't convey last year that I am coming, you get ready. That's fine, that we understand. But this time, from as an internal doctor and as an internal policy maker, I knew that what happened last year. I should have made a contingency plan.
Anticipated, you should
That
anticipated mutant variations.
this can again strike me.
Right.
Let me improve my facilities. Now, any facility, if I was ready for 100 patients, any facility can accommodate 200 patients. Even if we understand presently, as per the previous speaker, that the wave previously was like this, now wave is like this. Virus mutated. Virus mutation was well, you can say, anticipated, well proved 3 months back, that in the December, We, our scientists should have anticipated what type of virology we are going to have. One.
Right.
Second, our vaccine people should have thought of this mutation and should have started working on those viruses also, which they found in December in UK and South Africa and
South Africa.
Brazil. Second. Third, our hospitals, government hospital, they should say, okay, I've got so much budget. Let military should take second hand. Let's not buy these expensive aeroplanes. Let's improve our hospitals within next 6 months. We should be ready for those number of patients which we saw in 2020. When we would have ready for those number of patients, probably 150% of those patients could have been accommodated. Got my point? This goes by common sense. What is lacking in India is the contingency plan, is the planning, is a thought process. Now let's see, we are on brink. Let's try to come out. We are here to how to deal with the present problem presently, how to move forward, and how to do good in the future. We don't know means whether these politicians are going to learn or not. I don't know, but
Yeah,
as an
and what was
individual,
said, we need to all come together to tackle
yes,
this. Right
yes,
now, that is the need of the hour. This is not about central government. This is not about state government. You are sitting here in Delhi, sir. You tell me, does Gangaram Hospital have enough supplies to, or is to last through 2 or 3 days, or is
yeah.
it just a hand-to-mouth ad hoc existence?
Yeah, our chairman means he was not well, but he almost for 24 hours he didn't sleep. He is a real worker. He is a real warrior. He is 75 and he works in COVID ward. Most of the doctors run away after 60 years. And he's a real worker, and he has arranged everything, and we are passing through very safe time. Yesterday we had problem, means we anticipated 12 hours, 24 hours back, and we conveyed, okay, we had only 6 hours, so that our patient should not suffer. When we think of, say, patients, we think of 5 days ahead rather than 6 hours ahead.
Absolutely.
Only their way, in old days, granny, you're a housemaker, a homemaker, they are very smart people.
Like, plan ahead. You plan
they,
smart, right?
they
So that's
used to, then when they used to convey that this is a problem in my house, there won't be any problem, but they are anticipating that we will be deficit by floor after 10 days, but they will create that, okay, within 24 hours I want this, because they do not want a crisis.
right.
This is a crisis management, and you can say contingency plan, and our government should learn from people like you who manages home, your workplace, and how you tackle that goes with the common sense, and everything has grown up, everybody has grown up, I think.
That's thank you for having that much faith in me individually. But Dr. Natarajan, I want to really come to you and talk about this ad hoc nature right now, and then I want to come to you, Yogesh, to talk about the Nashik incident and the fallout thereafter, and what the inquiry, etc., might reveal going forward. But Dr. Natarajan, what I really want to talk to you about, and if you can sort of uh, there is this ad hocism that's going on. Every hospital right now. So I was reading a report, Max Hospital, certain Max hospitals in Delhi, they only have oxygen now for the next 2 hours, next 3 hours. Yesterday, the Delhi minister, he tweeted that we only have oxygen for the Delhi health minister, that Gangaram has severe oxygen shortage, only good for next 10 hours. GTB hospital in Delhi has oxygen shortage, good only for the next 3 hours. Now, this sort of ad hocism in terms of oxygen shortage and oxygen supply, why can't these are lives, as are evident from the Nashik incident? These are lives of people. If the oxygen tanker doesn't reach, people will die. We can't have a 3 hour timeline, ad hoc timeline for this, that there's 3 hours of shortage. How can this be addressed? How can this ad hocism go from for oxygen supplies?
Yeah, that's a very valid and very important question everyone is grappling with right now. Yes, the thing is we have next to no surge capacity. And that's a reality everywhere, whether it's oxygen, whether it is a matter of some drugs, whether it's a matter of, ICU bed availability. We don't have a reserve capacity. And given our population and the rapidly increasing numbers, it's not going to happen overnight. So, I mean, again, it is a demand supply equation. From the healthcare point of view, I mean, obviously, doctors and hospitals are expected to use oxygen very judiciously so that the demand is kind of under control. Supply wise, it is the responsibility of the government. Now, how they do it, how they can kind of streamline that whole process, they've probably not done this before because it was directly between the hospitals and the vendors who were supplying oxygen on a regular basis during non COVID times. Now that there is a crisis, the government has stepped in to kind of decide who gets what. So there is a kind of a priority list of hospitals that is, left to the best judgment of the government authority, whoever it may be, whether it is the collector over there or the FDA commissioner or whoever has been given that responsibility to decide whose requirement is most urgent. So there is absolute ad hocism there. But that's unfortunately become the situation right now, the crisis in which we are. So, like what happened with us last night, as I gave you the example, at that moment we were fine. We had enough oxygen till 9 a.m. today morning. Here was another COVID care center which was going to run out of oxygen within a matter of an hour in the evening. So, obviously, that tanker has to rush there rather than come to us. So, I agree, all this is absolute ad hocism. If we had a surge capacity wherein we could deal with this situation, or we were prepared to deal with this situation earlier on proactively, then we would not be sitting in this mess that we are now. But
And
solutions,
really, it doesn't matter if it's the central government or the respective state government, because it has to be a collective responsibility. People can't say that this is health is a state subject, so the state government should have. But this is a national emergency. This is not a state emergency. It's a national emergency, and there needs a collective effort to this. And thank you. I know I've stretched this beyond required time, but I really want to go to Yogesh, who's been very patiently waiting. Yogesh, I'm sorry for because I was so. I think we had to address the shortage issue and understand what's actually going on both in Delhi, in Maharashtra, and the rest of the country, really. But I want to talk to you about what the Nashik incident has brought to the fore, which is 21 lives lost. The relatives of those people obviously very angry, demanding action against the Nashik hospital. Securities had to be beefed up at that hospital in Nashik so that relatives don't. But what about the rest of the patients there? What about the oxygen situation at that hospital right now?
Right. So after the morning incident, it took around 20-25 minutes for the local authorities, the hospital authorities to restore the supply. In fact, when the relatives got to know that there's some issue with the oxygen supply, they barged inside. It led to a bit of a chaos, and in fact, it the overall thing resulted into some sort of a disorder. Putting the entire health staff into a deep shock, and then it actually took them more time to restore the supply. Fortunately, the other hospitals were they were roped in, the supply was restored. Now the entire episode, the entire incident has once again underlined that oxygen is actually a wall between life and death. There was no oxygen, it dropped, and then 22 people lost their lives. Maharashtra is facing one of the biggest crises. Like Mr. Natarajan said, there are a couple of other hospitals which face the issue, and now hospitals today in Pune have stopped taking patients because they do not have an adequate oxygen supply. That's the situation here. So situation is bad. Government also, for the first time dealing it, although they have taken control or the supply, we'll have to see how they do it in the coming days. As far as Nashik incident is concerned, now the chief minister has asked chief secretary to initiate the probe. My information is there will be three-member probe. One will be an IAS officer, one will be a doctor, and one will be an engineer to cover all three important aspects of the tragedy. We'll know what exactly the truth. We hope that the guilty, if at all there are any, will be punished and the responsibility will be fixed.
We
Last
hope
point
that.
I want to make before
Yes,
we
please.
finish.
Yes, sir.
Nothing will happen to the probe, and the center will try to blame the
I was
government.
about to say
Government will
that.
try
That
to center the
yes.
blame center, and Uddhav Thackeray will try to prevent himself. That okay, these were the agencies, and some small bugger will be punished, and they will let it go. They won't learn it. These accidents are bound to happen all over the world. These type of accident happen. Try to understand. 9/11 happened in US, but they have made their system that how we are going to respond next time. They failed, but they learned. We are not going to learn. But presently, I urge Modi ji, let this nation be one. Forget who is state, who is center. Forget where BJP is not there, where the Congress, or where the any other party. This is a national disaster moment. We have got hospitals like AIMS, Safdarjung, who are still 50% maybe non-COVID. Means I mean to say, each and every hospital should try to play role, whether it is run by center, whether it is run by state, whether it is run by municipality, whether it is run by INS, that is your navy, whether it is run by your army. Mean we are as human as any human is as human as whether it's a navy or any other branch. So they have got good resources, and they always help. The army always help. You just tell them we are in problem. Indian army is always there to help you out. I think we should have a national disaster management program that should take care of everything, and they should provide the resources whatever wherever is lacking. Time has gone to blame, time has gone to make these small committees to catch up the people, save the people. Once they are saved, only then we will be able to catch them.
I just want to add one thing to it, that it has to be a two-way street, sir. While the central government should absolutely do this, the respective state governments should also leave aside politics, leave aside who's ruling with state, whether it's NDA, whether it's UPA, who's ruling. But this is, as you said, a national emergency, and we need to put aside our differences, come together, and tackle this as one instead of getting into the blame game about first the surge and now, of course, the shortages that are, kind of pulling this surge into a completely different and very fatal direction. So let's hope that that happens and that happens soon. Thank you for watching, and thank you for taking too much of your times. You all have busy schedules, especially given what's happening at your respective hospitals. Thank you for your time. Thank you, viewers, for watching this broadcast. Stay tuned and don't forget to press the bell icon and stay updated with all Hindustan Times latest updates. Thank you.